have like an aha moment. I think a lot of people do. I grew up around physicians, my family. My parents had a couple friends who were physicians, and one in particular just made it seem kind of fascinating. From a really young age, I just remember thinking, yeah, that's what I'm gonna do. And I never thought twice about it. So I remember like my earliest thoughts of thinking that I would go into medicine are probably in middle school, definitely in high school. Like that's just always what I was gonna do. There's a lot of action. There's a wide variety of things that we do. So we don't just deliver babies, we operate, so on the GYN side of things. We see patients in the office, so from pretty young to pretty old. And the other thing I like about OB-GYN is for the most part, our patients get better. So they don't have these chronic medical problems. They come to see you for a pregnancy or they come to see you for something else. And usually we can help them get better. So I liked that piece of it too, because it felt like I was being proactive and kind of making a difference. There's a lot of things going on inside of pregnancy. So especially in a first pregnancy, if you've never done it before, there are a lot of things that change. So the mom's body will change, her psyche will change, her expectations and how she relates to other people changes. And so it's really just kind of navigating those changes and kind of helping set expectations for what is normal and to be expected, and then also identifying things that might not be normal and maybe things that we need to pay closer attention to or even treat inside of pregnancy. So really we're just trying to kind of set good expectations and also kind of help patients and women navigate that time where it's like no other time in the rest of their life. It's a very bizarre experience. And most people, until they get pregnant, they don't really think of it that way. Like everybody thinks, oh, you get pregnant, then you have a baby. That's your end. Like everybody's always about the end result, but they don't realize that pregnancy is a journey in itself too. So, and there's a lot of things that change, and there's a lot of like good and bad things too that maybe don't necessarily get talked about as much. So we're just trying to help support her and help her recognize what's normal and what's not, and kind of how to deal with the things that are changing and sort of set realistic expectations. So still really same thing, a lot of things that change, through the course of life, but also, outside of pregnancy, just in general, we are really sort of on the front lines of preventive health care, screening for breast cancer, screening for cervical cancer, helping to kind of support primary care physicians to make sure other health screenings are done. So that really starts as early as age 21. And then it continues depending on the patient's age. Different disease processes that you might be screening for would be focused on at different ages. So, somebody who's older than 40, we'd be worried about breast cancer. Somebody who's older than 65, we'd be worried about osteoporosis. And so really, those are a lot of the things that we focus on otherwise as preventive care, but still then also kind of helping women just navigate life. To go from 21 to 61 is 40 years. And a lot of things change. So, before you're ready to plan your family, then when you're planning your family, then when you're done planning your family, and sort of how your body's gonna change after that. And we're just kind of there for the ride and to help support women. I like to play golf. I have a dog who I also really like, and a husband, so I like to hang out with them. I like to work out, so I like to shred, and I also go to yoga a lot. And other than that, probably just spending time with my family.